Hey, Nassus, you can start.
Good afternoon, everyone. Thank you for coming to our health talk. I'm Sadam from SGH Community Nursing, and with me is Senior Staff Nurse Clarissa, who will be presenting the talk. Should you have any questions, please hold it until the end of the session, and we will attend to you afterwards. Clarissa?
Hello everybody. Hi, welcome to this year's Health Talk series. This is in collaboration with Vidima CC. I'm Senior Staff Nurse Clarissa, and today's topic that I'll be going through today is actually community falls prevention, and we'll be zooming into home safety measures. Okay, so I will start my presentation. Okay, so I'll go through what are the rough content that I'll be covering today. I'll be going through what exactly is a fall, what are the consequences of fall, and what is the incidence of falls actually in Singapore, and also what is a simple fall risk questionnaire that actually you can ask yourselves and see whether are you at risk of falling, and the common causes of fall, and the 5 tips to actually prevent a fall. And what are the home safety measures that actually, things that actually you can do to actually modify or take note so that you can actually prevent falls at home. Okay, so first of all, let's ask ourselves, right, what is a fall? So a fall is actually a sudden and unintentional change in position that actually causes someone to actually land at a lower level. So sometimes we think that many a times we like to hide the fact that we actually fall down. So we say, no, I just got down and then I got giddy a bit, then my buttock actually touched the floor. So as long as actually there's a sudden or unintentional change, is already considered a fall. Yeah. Okay, so many a times there are a lot of ill consequences that can happen from a fall. So it can be something as small as maybe bruises and cuts because of a fall that you sustain. You can have blue black at your knee, at your elbow, or even at your hip areas. Sometimes can also be quite serious, like head injuries. So head injuries, sometimes you can have blood actually on your head, maybe on the outer layer, maybe not so serious. When you do the scan, actually inside is okay. But sometimes can also be very serious when you have bleeding in the brain as well. And sometimes this can result because you actually hit your head against something, or you hit against the floor, or sometimes the fall actually happens in a toilet. Then maybe you hit your head against the toilet bowl. So the injury can be quite severe also. And then you also can have fractures, hip fractures. Sometimes when you try to break your fall, you use your wrist. So sometimes you can have fractures on your wrist also. And sometimes also there are other kinds of consequences, like when one time you fall down, you feel very scared of falling again. You feel that, okay, I think if I leave the house today, I might fall down again. So there's this fear that's actually inside of you. And sometimes because of a fall, you tend to not be as independent or as good as how you were before. So there's some loss of independence, and sometimes you don't feel very certain of yourself also. So there's also some loss of self-esteem and a decrease of quality of life. And in very severe consequences, you can actually also pass away because of a fall. So the reason why I share with you this is because sometimes you think that I don't need to tell anybody, I don't want to tell my daughter or my neighbor or my friend. It's a small thing on me. But maybe you don't know. Maybe there's a fracture. Maybe inside there's some bleeding. So it's always good to just go and see a doctor to get it checked out whether are you okay or not. Yeah. Okay, so in Singapore, actually, there's about 277.7 per 100,000 of adults above 65 years old that actually had unintentional falls. And most of these falls, right, 63% of them actually occur at home. So that's why we actually want to educate y'all, to tell y'all that, there are some things that actually can happen, can go wrong at home, and what are the things that you can do to actually prevent these falls. Okay, so actually the next few slides is a very simple 3 questions that you can actually ask yourself whether, hey, am I at risk of falling or not? No lah, only people who are much older, they are the ones who fall down, or people who have walking stick only fall down. Actually, as long as you're about 65 and above, you're at a really higher risk of falling. So these are a few questions that you can actually ask yourself. So the first question is, have you actually fallen in the last 12 months or in the last 1 year? So you can ask yourself yes or no. You can roughly keep the answer in your mind. The second question is, do you avoid going out because you are afraid of falling? So if you answer yes or no, so you can keep this in mind. And the last question is, do you feel like you're going to fall when you stand up or you're walking? So for example, when you're standing up and you're walking, do you feel like, hey, my balance not so good, I'm going to fall down? Or sometimes when you're walking also, sometimes you feel that you're not so steady. Do you feel that? Okay. So if you actually answered yes to any of these questions, you're actually at the risk of falling already. Yeah, so this is something to actually take note of. Yeah, it's nothing to be like ashamed of, like say, hey, how come I'm at risk of falling? Sometimes as you grow older, you know, sometimes certain things are bound to happen. Like for example, your eyesight is not very good, some unfortunate things can happen, then you also have a fall. So not only old people can fall down, even young people also tend to fall down also lah. Yeah. Okay, but the important thing is that we must know you can actually prevent these falls if you actually take certain tips that we are going to share with you today. Okay, so before I share with you the tips, I want to tell you what are the causes of fall so that you see whether are these the things that actually do you have or your friends may have or your loved ones, your husband, your wife, you know, even your parents also, you know, are these the certain conditions that they might have? Okay, so first of all, the first reason is actually sometimes because of poor balance. Yeah. So when your balance is not very good, you know, let me give you an example. Sometimes when you're a bit on the heavier side, so if you are a bit obese, sometimes your balance is not there. For example, even pregnant ladies also, their balance is not there because of their tummy, right? So same thing. So when you have poor balance, you tend to also, because the gravity is, you can't really feel well, so you tend to actually fall. And people who have difficulty walking independently, so people who actually need help, and they actually maybe need help not only from people to help them to walk, maybe they use certain, maybe use umbrella, or they use a walking aid, walking stick, or sometimes actually at home also, they use the furniture to help them walk. Yeah, so sometimes they hold the furniture and they walk, also shows that they have some difficulty in walking independently. Yeah, so these are the people very high risk for fall. Okay, so certain conditions also can cause you to fall or very high risk for you to fall. Arthritis. So sometimes when you have arthritis in your knees especially, so not very steady, or sometimes it gets very swollen, it can also cause you to fall. And sometimes if you have conditions like high blood pressure, diabetes, stroke, or Parkinson's disease, also can cause you to fall as well. So Parkinson's, because you know it affects, because your hand or your leg keeps shaking, or sometimes you have a certain way of walking, right? It's not very steady. That also can cause you to fall. So you must know about yourself. If you have these conditions, you must sometimes take some time, be careful when you walk, make sure you check, make sure your shoes are good shoes that you wear, so on and so forth. Okay, so high blood pressure also sometimes can, this condition also sometimes can cause you to fall, especially if your pressure is very high, or sometimes you take medication, then sometimes you take the medication and then your pressure go low, so also can cause you to fall. And then a condition like diabetes, so sometimes if you maybe have low sugar that day, you feel very giddy, have cold sweat, so these are the things that actually cause you to fall also. Okay, so the next one is medication side effects. Okay, so certain medications that you take day to day can actually cause you to fall. And for an example, like I told you just now, your high blood pressure medication, because it actually brings down your pressure sometimes. So that can also cause you to fall. Other kinds of medications also can cause you to fall. So if you take a medication that actually causes you to be very drowsy, so the doctors say already in the medication package, right? They say that this will cause drowsiness. So you already know this is going to cause you drowsiness. So make sure you don't go and drive, or make sure you don't go and run, do exercise and all that. Just go home and rest, because you're very high risk for falling. Urinary incontinence. So urinary incontinence is when you are not able to control passing urine. So sometimes, when you're trying to, like say you need to go toilet, but then suddenly it comes out. Yeah, so because of that, sometimes you also can cause you to fall. Then another thing that is very important actually among older adults is your vision. So when your vision is not very good, it can cause you to fall as well. So as we grow older, right, sometimes we have our vision gets affected. So it's actually good to go and get your eyes checked routinely. You cannot say that, my eye checked long time ago already, it should be okay one. My glasses, no issue, I got no headache. But it's good to actually check and see, is it maybe your eyes maybe not as good as before, maybe need to change the degree change, or maybe you don't need so high also. Sometimes when you wear too high also can cause you to have headaches. Yeah, so that's good to actually go and get your eyes checked also, because that causes you to fall as well. Okay, then inappropriate footwear. So sometimes this is very common. Even not only older adults, even me also, I fall down because I never wear proper shoes, never wear proper slippers. So slippers can cause you to very high risk for you to fall. People can actually step on it, or the slipper behind don't have very like how to say, don't have grooves at the back, so can actually cause you to slip, especially during wet times. The floor is wet and all that. So having a good pair of shoes are very important. And lastly, hazards at home. So these are the things that today we're going to look into. Some hazard at home will actually cause a lot of older adults to fall. Yeah, so I'll go through that later. Okay, so how can you prevent yourself from a fall? Okay, so generally, these are the 5 main tips to actually prevent from fall. Today, we will go in depth about how you keep your home safe and neat, things that in your house that you can actually do, you can take note of. You can actually feel that, actually, this thing I should always make me fall down. Maybe I need to change certain things in my home. Okay. Secondly is to keep your bones strong. So many times our bones are not very strong as we grow older. So in the upcoming health talks, if you join us, we will go through what are the things you can do to actually keep your bones strong. And like just now I explained to you, go for regular eye checkups. So that's something that we routinely see among older adults, like, oh, my eyesight not very good, so that's why actually I fall. Okay, and wearing well-fitting non-slip shoes. Yeah, so these are just a few examples of good shoes. So you see inside the backing, there's grooves to actually prevent friction, so that you actually will have a better grip when you walk. And also when you exercise regularly. Sometimes when you're always at home, you don't really go out often, and then suddenly now you want to go down to the shop, right? Sometimes it might be a bit difficult to walk. It's normal because you have not been going out so much. But if you always routinely, sometimes every day, 5-10 minutes, you do a little bit of exercise, so you are used to it already. So try to exercise regularly so you keep yourself and your muscles fit also. Okay, so let me go through the home safety measures. Okay, so this one is very common. In our Asian household, right, a lot of us like to have these mats in the house. So if you see the picture on your right, we like to use, in some houses, we don't even use mats. Like my mother's house, right, don't like to use mat. We just use old cloth and all that. But what we notice, right, a lot of times, a lot of older adults, they fall down because maybe the corner is folded and they trip on it, and then very fast the fall can happen within a few seconds. Maybe you're cooking or you're washing the dishes, right? Then you just so happen to turn and you trip on the corners because this is not anti-slip. Yeah, so we actually recommend try to remove any loose mats that you have at home. Okay, so sometimes I tell this to my patient, right? And then my patient all scold me. They say, yeah lah, Missy, you know, you very easy to say throw everything, is all these are money. So one way to do is actually, okay, so say you don't want to throw away this kind of rug, right? What you can do is that you can buy the anti-slip mat also and put it underneath. So sometimes they sell in some of the convenience shop or even the hardware shop near your house also. You can cut it accordingly to the size and put underneath if you still want to use this kind of mats lah. But if you can afford it, or if you don't mind changing, you can actually, I would recommend to get a non-slip mat. Yeah, so something like in the picture in the left one, so that when you put your feet on it, right, it's quite firm. Okay. Yeah, so secure with a slip-resistant backing. Okay. Okay, so many a times in our homes, right, you know, sometimes you spill water, you know, or after mopping, you know, because maybe in your house you have a helper and then she, you know, or maybe sometimes we also, when we mop too wet the floor. So because of that also, it can cause you to fall. Or you have some spills on the floor that you never see. Maybe the children, the grandchildren in the house, they have some water they spill, then you never see, then you also can fall. So always try to clean up any spill on the floor, keep the floor dry at all times. This one is very easy to fall, and usually when you fall, right, you always hit your head and hit your back. Yeah, so this is something to be careful of now. Okay. The next home safety measure is actually try to keep your commonly used items at shelves that are easily that you can reach lah. So for example, right now, if you see in this picture, if say now this is a picture in the house where you know you like in the morning you need to make your coffee or tea. So obviously put at an area where you always will take, easy for you to take as well. If you're going to put in a very hard to reach area, you also cannot reach, then you might use a ladder or a step stool to actually help you. And usually when elderly use a step stool, sometimes it's higher risk for falling. So we always encourage, try to keep things as low as possible and in easy to reach areas. So if you have sugar, salt, your oil, if you eat oats, your breakfast, your bread, all those things should be in easy to reach areas. Then maybe things that you don't usually commonly use, like maybe, you know, your baking things or your steamboat, you know, things that you don't really use every day or weekly basis, then you can put those things in higher areas. Yeah, so place commonly used items at shelves that can be easily reached. Yeah. And then if say you need, okay, you really need help and you don't feel very confident, you know, maybe you feel a bit giddy, you know that if you're going to use the step stool, you might not, you might fall down. So try to see whether can you get someone to help you. Hey, can you help me? You ask your grandchildren or your children, can you help me to take this weekend? I need to make for Chinese New Year some kueh kueh. I need the baking items. Can you help me? So try to get someone to help you in this area. Okay, this one is very common also. I have a lot of patients who actually trip because of this. So it's all your wires on the floor. So if you notice nowadays, we have a lot of things like we have our phone, then the TV, you know, got a lot of electronic items everywhere. So we tend to have this extension cord and the wires are all running everywhere. So this is very commonly, especially nighttime when you cannot see, right? Maybe you get up to go to the toilet. Sometimes you can trip on these wires and you can fall and hit. And when you trip, usually you fall forward. Yeah, usually. So one of the tips we recommend is actually see whether can you get a cable tie. So if you see in this picture on the left-hand side, it's actually a cable tie to help to tie those wires together lah. So it's a bit neater. And if you see this in this picture, they actually use a red color cable tie. So it's something a bit colorful, so you can actually see it better, and then it keeps things quite neat and tidy. Yeah. And then try to keep your floor free from clutter. So if you can, try to keep them against the wall. So usually I will encourage if you can pin it up, right? Sometimes you can get them to put it up on the wall, those sockets and all that. So if you can actually do it, better to keep it up. Try not to keep it on the floor where you usually walk and you need to clean up and all that. Okay, so for example, the next one. So if you see, right, in this picture, one of the house, the living room is actually very brightly lit. And then the other house is, dim lights and all that. Nowadays, dim lights in younger houses is a fashion lah, but it's not very good actually for your eyesight. So we always encourage, try to actually make sure your rooms are well lit. So if there's good lighting in your room, you can see clearly of your items, what things, where are the things, am I going to hit into something, or did some of you might even take care of grandchildren. So, your grandchildren toys are around. So sometimes you cannot see very well if the lights are not very bright. So you might actually trip on the toys and so fall down. So try to ensure your rooms are well lit. Yeah, when you walk through or you're going to the toilet and all that, lighting is very important. Okay. So try to also keep your floors free of clutter. So now Chinese New Year is coming. I always encourage most of my patients, not only Chinese patients, everybody lah, holiday, right? So it's good to actually do some spring cleaning. Things that are not necessary, you can actually give them away or actually throw away all items. When your house is very messy, got things everywhere, you very high likely to fall. Yeah, so you trip on your own items itself, or okay, not only messy, sometimes you all tend to have a lot of boxes in the house, then there's no pathway for you to walk. And because of this, elderly fall down. We have seen, you can ask a lot of the nurses and doctors, most of them, they come in, they say, oh, actually, I don't have place to walk. So that's why nighttime never see properly, then I fall down. Yeah, so try to throw away things that are not really necessary lah. Keep the things that you need and keep your place. There's a proper pathway for you to walk. Yeah, so this is important. And then maintain clear paths for you to walk. Especially if you are in a house, right, that actually has, people actually use wheelchair, or you need to use a walking stick, walking aid to actually walk. So you need more paths, a bigger area for you to actually walk. You cannot be, quite squeezy and all that. So try to clear certain things so that it's easier for you to walk, push wheelchair and all that. Okay, so another instance that we realize when we hear our patients tell us when they fall and all that, we realize actually a lot of times they fall down is during the night time. So as you grow a bit older, you tend to go to toilet at night time a bit more frequently. So this is part of aging. So, and that's where we realize actually a lot of elderly reported that actually they had a fall during the night time when they were trying to get up. So we always recommend that if you can, try to keep a bedside lamp like this, or you can also buy the nightstand, the night light, sorry. So sometimes we use night light for children when they were young. So I also recommend my patients, I would say it's quite inexpensive. You can actually buy and put in your socket. So at least there's some light, and then you can leave it on at night. I got some patients who also actually, they feel very unsafe because 1-2 times they really fall down at night. So they actually leave the lights on lah. But you don't need to leave the lights on. You can actually even have the bedside lamp that will help you. Yeah, so that you can actually switch it on. You know you're going to get up, go toilet, so switch it on, and then you can go to toilet easily. So we also notice that a lot of times when patients want to get up from the bed, they get up too fast, become very giddy, and then they actually, the room is spinning for them. That's when actually they fall down. So take your time, get up slowly, take a breath, you feel better, then you slowly get up, and then you go to the toilet. So a lot of times, these are the things that happen. So that's why we encourage you to just take note of it now. Okay, so Another thing is that we also encourage to install grab bars for extra support. So if you all know, if you all live in HDBs, that actually there's this program called EASE program. It's an enhancement for active seniors. So you can actually enjoy subsidy for installing some grab bars to actually help you. So actually some houses nowadays already have these grab bars. And then when I go to my patients' homes, they don't use the grab bar, they put their hand clothes on this thing. So make use of the grab bar. The grab bar is very useful, especially for those people. Okay, I give you an example. Those people who actually go to toilet, and then when they bend down and they're on the toilet bowl, right? Then after that, when they need to get up, right, their knees are not as strong as before. So actually try to use this grab bar. There's one grab bar that is straight like this, and also one on top. So you can use both to help you. Yeah, so usually I'll tell my patients, don't use this to hang clothes. When one day you really feel giddy, you really need it, right? It's very useful for you now. So you can actually get them to install it. This is really very helpful in the toilet. Because we notice another area where a lot of older adults fall is also in the toilet, because that's when they get giddy, they feel breathless, they get chuan, or suddenly, they're low sugar, or the floor is very slippery, got a lot of soap, and then they actually fall. So another thing that actually I encourage, right, when you shower, try to make sure that you wash away all the soap on the floor, because the next time you use the toilet, maybe you come just to use the toilet only, then it can cause you to fall also. So these are things that very frequently happen and we notice. Yeah, so there's something to take note. Okay. If you're interested in the program, actually, you can go and visit HDB website and see whether are you eligible. Okay. Okay, so overall, try to concentrate when you're walking. Nowadays, a lot of us have handphones, so we are busy messaging, or, in the WhatsApp group, they send a lot of videos, and then you're watching the video and then you're walking. Even I have patients who don't have to be, older adults, even as young as 40, 50 years old. They actually watch the video and then watch, happy at the MRT station, then they fall down because not concentrating, then never see the stairs. So try to concentrate when you're walking, try not to take out your phone and look at the same time. We will not be able to multitask as well. Yeah, so that's something very important to take note of. Try to use the lift instead of the escalator where possible. So if you notice in certain shopping centers, the escalators can be very fast. There are some that are faster than the rest, if you see. So if you feel very uncertain, if you feel that, okay, I don't think I can do the escalator, it's too fast, I might not be able to put my foot properly. Because if you're going to have a fall at the escalator, right, I assure you, you'll be quite you'll be quite bad injuries that you're going to suffer. You might have head injury, fracture here, fracture there. So if you don't feel confident, it's okay. Nothing wrong to use the lift. So you just go ahead and find the lift nearby and then use the lift where possible. And then I noticed that every time we are in a rush, we are trying to rush here, rush there, need to go market before market close, I need to go to the shop, I need to go fetch my children, grandchildren. So try not to rush as much, try to take your own pace. So if you know you have a certain activity today, try to leave earlier. Yeah, so that you can, minimize the falls that you will have. Okay, so the next point is actually wait till the bus or train has fully stopped before you actually stand up. I recently had one elderly, one of the neighbors at my block actually, who actually fell down because in the bus actually. They got up actually before the bus was going to stop, and then the bus is going quite fast, right? So the balance is not there, then couldn't hold on to any railing, so they actually had a fall, and the fall was quite bad, got very big bruise and all that. So try to make sure you wait for the bus to fully stop, use the bus to actually help you. Yeah, and also another area where people tend to fall is actually when you're getting down from the bus. So try not to rush, or make sure your stop is coming, then make sure you press the bell or that. Don't rush last minute, because sometimes the driver don't see you, they tend to close the the door at the back. Yeah, so especially when the bus is very full with a lot of people. So this is one area that I noticed that I have some older adults actually having issues falling in the bus and all that. Yeah, so try to be a bit careful. Avoid going out at night. So the reason why we say this is because nighttime our vision is not very good, and also we tend not to see things well on the floor. So make sure you try to if it's possible, get all your things done in the daytime where you can see well and you're also not so tired also. Avoid going to crowded places. Crowded places because I mean definitely now during this period, during COVID, definitely don't go out during crowded. If there is a lot of crowd now, I would really encourage. And now it's raining season also, please be very careful of the floor. Yeah, because in some areas the floors are not very very slippery, especially when it starts to rain. So be a bit careful. If you need to go out with someone, get someone to help you also. Or if it's not really important, try to, push later on, then you go for your appointment. Not appointment, or things that you need to do it at a time where it's not raining now. Yeah. Wear well-fitted shoes with non-slip groups at the back lah. So this is also very important because a lot of times we fall because our shoes are not good shoes. Yeah. So but nowadays actually I see a lot of elderly very good. They really wear very good shoes, covered shoes. Even if they're going down to the shop to buy just a few barang-barang also, they wear very good shoes, covered shoes, track shoes, because they understand the importance of having very good shoes lah. Shoes that are well fitted also helps you. You can walk long and you won't have a lot of pain also. But not only that, it also ensures that you don't fall down because of these bad shoes. So even if say really urgent, you need to go when it's raining, if your shoes are quite good, there's lower risk of you falling if you have proper shoes now. Yeah. So the last point is actually use appropriate walking aids. So I notice sometimes I think because we are very in an Asian culture, we are a bit paiseh to like when the doctor say it's good actually if you use a walking stick to help you. Maybe you're after you have some medical issues, you need to use a walking aid or something. But because you're very paiseh that what people will say, so you don't want to use. But you see, I'd rather you be paiseh now, then later on you fall, and then you're in the hospital, you cannot go home. So try to use the aids that is recommended for you, and don't try to buy your own one. Get some recommendation, especially if the doctor really tell you that you need to use. So if you need to use a walking frame, then make sure you use a proper one. Then sometimes they like to use umbrella. Nowadays there are some umbrella that are special for walking, but some isn't. So sometimes the umbrella also can cause you to fall if you don't get a good one. So try to use the appropriate walking aids to help you. Yeah. Okay, so I've come to the end of our health talk. These are all the tips that we want to share with you in this session today. Do you have any questions or things related to home safety that you all like to ask that I can help to actually answer any questions?
Yes, thank you for the talk. May I ask you how to choose a well-fitting shoes, a pair of well-fitting shoes? Thank you.
Okay, so I just roughly go through, but I think in the upcoming talks, we are going to talk in great detail, like what are the things to look out for in a shoe. So usually we recommend a shoe should be well fitted, so you don't go and wear shoes that are bigger than what you're supposed to wear. So for example, if you are size 5, you should buy a size 5 lah. Don't go and wear size 6, size 7 because it's on sale. Okay, so very important, wear the right size. And also, I would encourage to wear covered shoes. It helps to protect your feet as well. And if you turn to the back of your shoe, right, your shoe should have some grooves in it, not flat base. Yeah, because if it's flat, right, very easy to slip. Yeah, so which goes to show that I don't recommend to use slippers actually. Even if you're going for a small walk, right, I always encourage to wear shoes. Yeah, because it's more comfortable for your feet as well to wear proper shoes. And if you wear slippers, so it's not good for walking actually. Yeah, so these are the at least a few tips you should take note of, and something with a broader base. So that means also, right, you shouldn't be wearing high heels lah. Yeah. So usually if you know, right, doesn't mean those young ones wear high heels don't fall down. They also fall down. Yeah, because there's no proper balance. I mean, no proper stability the shoe. So that's why they tend to fall. Yeah. But if you really want to wear something with a heel, usually we recommend a little bit of wedges where it's like, there's a bit of a heel. Yeah. So that one at least give you a little bit of height, but it's not too high. And it's a broad base heel, you see. So there's a firm base for you. So these are the few things that actually you should take note when you want to get a proper shoe. But don't worry, in the upcoming health talks, we actually will go in great detail. Then you can actually take some pictures, and then when you're actually going to buy a new shoe, then these are things to take note of. Yeah. Thank you for your question.
If you don't mind, I ask you another question.
Sure.
How about wearing slippers at home? Is it safe?
Very good question.
Thank you.
So I know some people wear slippers at home because the floor is cold, or it's a habit already. Got different reasons why people wear slipper. So it depends. Okay, but if you can, I will recommend that try to get a slipper that is also has the grooves at the back, because some people cannot take the cold. Some people believe that the floor is very cold, so it will affect their bones and all that. I understand that. So if you really want to wear a slipper at home, I will encourage to wear a proper slipper that has grooves at the back, or the one that has a cover on top. Yeah, I don't know if you can understand what I'm saying. Yeah, so but definitely don't wear just socks at home. I know some people, because it's cold, especially nowadays, the weather has been a bit cold, right? They just wear socks. Don't wear just socks, because socks is very slippery. So wear a slipper, but wear a slipper that actually is the house slipper kind that you can actually find in the shops, and behind has a bit of grooves. Yeah. And just be a bit careful, especially when you're wearing slippers. Sometimes if the floor is wet, sometimes you tend not to notice. So just be a bit more careful. Yeah.
How about Japanese rubber slippers? I always wear it at home. Is it safe?
It depends. We must take a look at how it looks like. But sometimes rubber slippers also can cause you to fall also. Yeah, so it really depends on what kind of rubber slipper and how it looks like also. But at the end of the day, right, because sometimes you might not find something that's appropriate, because sometimes we have a bit of foot issues. We have maybe some different kind of problems at your feet, right? So only certain kinds of shoe fit you. So it's okay to purchase whatever shoes, but just be a bit more careful, especially when you wear slippers at home. Yeah, because sometimes you can trip on the slippers also. Yeah, so just be a bit more careful.
If you don't mind, I tell you, because from young on, I was told when I walk, my heel, my 2 feet, the heel of my feet can never really touch the floor. But I have been so many decades already. Is it okay?
As in you're asking me whether your feet don't touch the floor, is it okay? Is it?
The heel, the back there. But I dance.
As in meaning, as in, okay, wait, sorry, I don't understand your question. So you're saying that you wear slipper, you don't touch the floor? Sorry,
No. Whether I wear shoes or not now, or whether I slippers or not, from young on, my feet never, when I walk, never really the back, the heel, never touch the ground or the floor.
Okay.
But I like jumping, but I dance also lah. Maybe. Is it okay?
Okay, so in situation like that, right, I would recommend that you actually go and see a doctor, and then you ask them whether is it okay or not, because I cannot really see very well now. I cannot visualize also But I recommend just to see. But definitely when you go for your dancing and all these things, right, just wear the appropriate shoes lah, and then just be a bit more careful. Yeah,
Oh,
but it's good to see a doctor and ask them whether, is my feet okay like this? And sometimes if you go to polyclinic, and they can also refer you to a podiatrist, which is they specialize in the feet area lah. Yeah, so you can actually go and seek advice. They will actually give you advice based appropriately for your feet, because everyone's feet is very different. Some people have different issues, like they got certain bones sticking out and all that. So it's best to actually see a doctor and then just ask the advice.
thank you
Thank you.
very much. Thank you. Thank you for
Christina.
your answer.
Yeah, actually, sorry, can I just ask? So
Yeah,
actually,
sure.
what is your advice? It's better to go barefooted at home, is it? Rather than wear slippers.
No, okay, this one I would say is a personal preference, because sometimes
Oh,
I would think, because nowadays I know a lot of people wear slippers at home. I won't say there's any right or wrong, but you just need to be a bit more careful. Yeah,
mm,
because there are some people who are encouraged to wear slippers at home because maybe the floor is dirty, or sometimes you all have pets at home, so it's not convenient. So it's okay if the doctor feels that you can wear slippers at home, but just be a bit more mindful, because sometimes slippers also can cause you to fall. Okay, the
so
slippers are
actually,
not very good
barefooted is safer lah. Barefooted is safer lah,
Yeah.
compared to wearing slippers.
But
That's what you say.
Yeah, but I know sometimes, even because sometimes I know some elderly wear slippers also because the floor is very cold.
Yeah,
So
correct.
I would encourage also to wear. Yeah, so if you feel cold and your bones are aching, it's okay to wear, but just be a bit careful. That's all.
Okay.
Yeah.
Okay.
Mm.
Thank you.
Thank you.
May I just add a little bit more? So when we wear shoe, whatever shoe or in the community or at home, right, do take a look at your sole, which is the back. Make sure there is sole lah. It means that sure there is some friction. So if there's no friction and water actually step on water, the person might fall. So it's really important is that back, the behind the sole. Yeah. So I just add on this point lah. Okay. Thank you.
Thank you. Do you have any other questions? Thank you so much for the questions. I think it's very helpful so that others also can, understand and learn also from your questions and answers.
The question I asked, what does the walking stick, is there a special height that you have to use?
Yes, usually actually by right it should be measured. So it's according to your height. So if you're taller or if you're shorter, usually they'll measure, and then there are different holes, right? Usually. So usually a physiotherapist can encourage you. Or nowadays, even when you buy from the shops, right, they can also tell you how to get the measurement also to be done. They usually will measure. Yeah. So I don't really recommend to buy things off the rack. I don't recommend, because all of us are different size, different, length and all that. And some people's hands are longer, legs are longer. So I usually will recommend that get someone to measure it for you when you want to use it. Yeah. So usually physiotherapists can help you with this now. So when you go and see a doctor at the polyclinic, you can also ask them to see whether can they get a referral for you. Yeah.
Or
And sometimes, for example, some people need to use walking frame, both, but they only use the walking stick. So you're not using what you're supposed to use. Yeah, maybe your both side is quite weak, so you need to use both. But for some patients, they're only left side weak or right side weak. So that's why you need to make sure you get proper walking aids if you need it. Yeah. So always try to get the professional to assist you, see what's your issues. Maybe you have some leg issue, feet issue, then they will advise accordingly.
but if we go to the shops to buy equipment that has got this measuring stick thing,
Yeah. So some of the shops, right, they have vendors there to actually assist you, to actually give you proper education. Some of it is just there is no assistance. So when no assistance means we have to just anyhow tikam by. I won't encourage. Yeah, I will encourage that if there are shops in the hospital that where you get, right, usually people will able to advise you. Yeah. So
Where the nearest place to buy?
so if you go to a polyclinic, you can ask a doctor to
Polyclinic, just to buy a stick, you have to refer the doctor,
correct. Yeah.
reference.
So that one, so what I'm
It's
saying is
not
that
very inconvenient, right? If you just let us know, no need referral, but we just tell us where the shop where we can buy and directly use. You know, I mean, going here and there just to get the stick is a waste of time, right?
understand. So if say you don't mind to go and see a professional, you can do that. But you say you want to actually go to a shop, there are some shops in the hospital itself where there are vendors who sell it. You can actually seek their assistance. I am not sure of shops outside because sometimes they don't have people to help. Yeah, so I might not be able to give you the best advice in that. But usually for my patients, I'll recommend from the hospital because there's people to actually help you and assist you. Yeah,
Oh, I see. Okay, thank you.
yeah. Thank you for your question.
Sorry, may I
Okay,
just
and,
add in some? The reason why a PT need to assess the client is because of firstly the certain height. Secondly, it because the amount of strength. Sometimes I might be very strong on my dominant, my good hand. Sometimes because of certain issue, I need to use my left hand that's weaker. So they will adjust the height according to my height. And sometimes I look tall, but actually I maybe not so good in walking. So that's why they actually would like to have a physio to take a look at the client. So there is a few reasons. Yeah. So actually, if you ask me personally, if the best way is still need to be like assessed by a physio because the vendor who went there, right? You also not sure whether correct or wrong. So it's good to like physio assess and then they teach you the proper way of holding the sticks because some stick inside below got 4 legs, some are only 1 stick, which is a walking stick. So different technique to use that device. So that's the reason why there is this workflow where no doctor need to assess, give to physiotherapy. It's a bit it's troublesome, I understand. But then because of their expertise, so that's why it's better to buy a guarantee lah. That's how I take it lah. Okay, thank you.
what
I
about
think
in the
someone was
pharmacy?
asking.
What about in
Ah.
the pharmacy they sell?
So pharmacy
Pharmacy.
they do sell, but then it really depends on the vendor whether they are around or not. Because some pharmacy I saw there's walking stick, but then that might not have anybody to assist you.
Oh, I
Yeah.
see. Okay, I got it.
Excuse me, yes, now you say we can use an umbrella. So an umbrella, can it serve the purpose as a walking stick?
No, as in I'm saying that some people use umbrella to help, and there are some umbrellas now which is it is I see among elderly, I think they buy online or on websites, right, where the umbrella below part is also sort of supposed to be a walking stick lah, right? But I would not encourage to use umbrellas because the base is not, it doesn't have much support. Yeah, so I would not encourage that. I would still encourage a physiotherapist to actually see and encourage. But if say you actually really need help and you're not even using anything and you at least use something to help you, okay lah. Sometimes, some of my patients, they don't want to die buy, maybe because sometimes money is an issue. Yeah, so sometimes they at least use something. So sometimes I close one eye, but I would really encourage to get a physiotherapist to see and get the proper equipment. Yeah, so that's what I normally would encourage.
Okay, just now you said, okay, when sometimes you may need to use an umbrella. The umbrella, some that with the rubber stuck on at the tip, that one is more safer than those without rubber, right? Am I right?
Definitely the one with the rubber will be a bit more safer. Nowadays, don't even have the rubber one. Like now got the 4 one or so, some special one from I think from China. So there's different kinds, but I'm not very sure whether like how long you use and whether is it good enough, because we don't recommend this from the hospital lah. Yeah.
Okay, thank you.
So I can ask another question.
Yeah, sure.
For my case, I had this wobbly leg because sometimes the knee get pain, but I can walk without sticks, But for safety reason, I always carry the umbrella to balance myself.
Okay.
But you see the road there, our road sometimes a bit unstable, and then you climb staircase, got a big problem. So this umbrella helps me. So do you think I need a special umbrella to carry along? I mean the walking stick.
Okay, so like you mentioned, right, that it could be because of your knees and all that, right? So I would, if it's possible, if you have time, like say when you're going for your normal review with the doctor, right? Also, you can just see whether you can get a physiotherapist to see. But if say it doesn't, if you feel that it's a bit troublesome for you, then I would suggest to get something with a bit more backing at below, because sometimes umbrella you use very long, it will wear off and it can cause you of a hindrance more than helping you. Yeah, I got see patients even with umbrella also fall together. And what I worry, the reason why I asked you to see a professional, because maybe you don't need one only, maybe you need two. I'm not very sure, I'm just giving you an example.
Okay.
So yeah, better to just see and get insight from them. Physiotherapists, right, they will give you a lot of very useful advice, so that you can actually see that actually the way you're walking, right, actually not very good. Then they can help you adjust certain things, give you certain advice, and then you can actually bring the umbrella that you have. You can ask them, is this okay or not? So they are very helpful to assist actually. So if you have the time and time permits, you can get a referral. I really encourage. Yeah. I hope that helps you and answer some of your questions. Okay, I think we have come to the end of today's health talk. Thank you so much for your time. I really appreciate all the questions, and it has been very engaging to hear a lot of the questions now. And I wish everybody Happy New Year, and hope that during this period you also try to clean up your house and keep it safe also, and keep yourself safe during this COVID time now. Okay, thank you.
Thank you very much for the talk. Thank you.
Thank you.
Thank you so much.
everybody.
Thank you.
Thank
Thank
you.
you.
Bye-bye.
Bye.